Ventricular fibrillation is a cardiac arrhythmia whose cause is not always known. However, the most common cause of ventricular fibrillation is an abnormal conduction of electrical impulses traveling through the heart. Commonly, this abnormality is seen after a patient's first heart attack or as a result of other problems which cause scarring in the patient's heart muscle tissue. Some causes of ventricular fibrillation begin as a rapid heartbeat, known as ventricular tachycardia. Ventricular tachycardia is a rapid but regular heartbeat caused by abnormal electrical impulses which start in the ventricles. On an EKG, the irregular quivering of the ventricles show up as a rapid, disorganized wave. There are no observable atrial waves on the strip. Due to altered electrical conduction of impulses through the cardiac muscle, the contractions of the ventricles are abnormal. Instead of strong, regular contractions, patients in VFib produce ineffective quivering. This means the blood is not effectively being pumped out of the ventricles. For irregular contractions, these patients face cardiac arrest and death if they do not receive treatment immediately. Patients who have untreated VTAC can go into VFib, and other major causes include coronary artery disease and MI due to the lack of blood flow to the myocardium. However, other conditions can cause a patient to go in VFib, such as cardiomyopathy due to dilated weak ventricles, valvular heart disease due to obstruction between the atria and ventricles, which causes an increase in pressure in the ventricles. As a result, the ventricular chambers enlarge, which ultimately alters their volume and pumping ability. And finally, some medications and fluid and electrolyte imbalances can cause VFib. Due to a lack of blood flow as a result of the quivering of the heart, these patients often present with loss of consciousness, apnea, and absence of pulse. It is important to remember that VTAC is not the same thing as VFib. Remember, VFib is rapid, totally uncoordinated contraction of the ventricular fibers. On an EKG, this shows up as chaotic electrical activity, and clinically speaking, the patient has no pulse. VTAC is defined as a QRS greater than or equal to 0.12 seconds and a heart rate greater than or equal to 100 beats per minute. The concern with VTAC is the probability of slipping into VFib. In order to prevent this, recognizing the signs and symptoms of VTAC is important to the care of your patient. Signs and symptoms of VTAC are lightheadedness, dizziness, palpitations, fatigue, chest pain or pressure, shortness of breath, and fainting spells. The treatment for a patient in VFib is defibrillation. The goal of this is to shock the heart back into normal sinus rhythm. However, if an AED is not readily available, bystander CPR is encouraged to start as soon as possible. Some medications that may be given in order to help with the defibrillation process are amiodarone, epinephrine, lidocaine, and vasopressin. These drugs are used to facilitate the return of spontaneous pulse following defibrillation. Patients who survive an episode of VFib, whose episode does not have a clear cause, will probably undergo a placement of an implantable cardioverter defibrillator, or ICD, for long-term treatment and care. The glove is simulating the heart, the hand is simulating the force of a contraction, and the water simulates the blood coming out of the heart with each pump. In this demonstration, you can see how the simulated contractions cause for irregular amounts of blood to be ejected from the heart with each simulated pump.